All right, welcome back to the Indiana Collegiate Action Network and the Indiana Coalition to Reduce Underage Drinking Alcohol Awareness Month. And this episode, we are joined by Eric Tekse, who is a longtime staff person at Indiana University at Indianapolis. Welcome, Eric.
Thanks for having me.
You bet. So for the audience out there that may not know you, just give a brief introduction, your role at IU Indy, and then we can jump in with our questions.
Yeah, sure thing. So I'm Assistant Dean of Students and Director of Health and Wellness Promotion. Big, long sort of compound title, but it's the office that does education and outreach. So we are not one of the medical units on campus, but really the prevention office on campus. I've been the director here since 2019, and I've been at IU Indianapolis since, gosh, way back in 2013, before my office actually existed.
Understood. Yes. Absolutely a longtime partner of both ICANN and iCrud. So we greatly appreciate all your efforts in the past. So with it being Alcohol Awareness Month, we wanted to have an opportunity to check in with a couple of the campuses around the state and just ask some questions about things that are happening on your campus. So we'll get started here. IU Indianapolis requires alcohol education for incoming students, right? And so question is, in your opinion, how does that early prevention shape your approach to Alcohol Awareness Month and honestly all year round?
Yeah, well, I mean, you mentioned all year round. It really is an all year round thing. Sure, there are definitely times of the year that are a little bit more crucial from like a prevention point of view. We do use one of those big third party, online modules for incoming students, as most campuses do, because it's a great way to catch everybody up to speed on the way in. You never want to assume what somebody's prior knowledge or experience is with these important topics before college. Some people come from high schools and they have great health classes, content covering this even as early as middle school. And some people, they're learning this material for the first time. And so, yes, the online education is a big, important piece, part of what we do at the tail end of orientation and into first year seminar classes. But it's something that we continue really throughout the year. There's always, we're always using different communication channels, information tables, events, collaborations with organizations. So it never really goes away. We're never done talking about it throughout the year.
Absolutely, absolutely. And it's interesting and as we answer some and respond to some of these additional questions, if you want to weave in there any sort of a recognition that IU Indianapolis over the last several years has transitioned from a primary commuter school to having more and more students actually living on campus. And so there's different dynamics I'm sure you've seen in your role over the last 10 years. So with that kind of as a background, just thinking about kind of the IU Indianapolis kind of strict policy on alcohol on campus and just thinking through how do you balance that with some of the realities and actual support for the students?
Yeah, absolutely. So, I mean, first and foremost, our student conduct office does a great job with enforcement, and they take a really nice approach towards really, I don't know if rehabilitation is a good word for it, but really sort of like it's a developmental approach to policy enforcement where we know if a student's going to make a mistake, they're going to have a lapse in judgment. We want to have some corrective action there, but they actually take the sanctions for alcohol and drugs and send them over to our office to do the educational interventions for those. And so we use one-on-one approaches for those. We have sort of like a tier one that is a little bit more educational background content about alcohol, how it affects the body, learning someone's limits, things like that. And then we have more of like a tier two. If people are in the field, they're going to recognize the term like a basics intervention, right? It's like a two-part, more of a motivational interviewing, motivational enhancement type intervention to really help establish some goals for harm reduction or cutting back or making changes with the use. So it's a good collaboration across really sort of like the enforcement side and the prevention side. And our campus also really we adhere to the spirit of the Indiana Lifeline law. That's something that was just recently expanded to include not just the caller, but victims of like an alcohol related emergency. And so our campus is gonna respect that. If someone's making a call from a residence hall, for example, it's not all about, trying to like bring the hammer down on somebody. It's about trying to just make sure everybody's safe and healthy. And then after the fact, we can make sure that there's education in place. So, I mean, it's a good sort of a balance. I'll say one of the unique things about a campus like ours versus more of, maybe like a college town kind of a campus is that our relationship with the police is really integrated. We have the IMPD really kind of right in our backyard, along with campus police right here on our downtown campus. But one of the challenges is that a lot of our commuter students live all the way around the Beltway, right? And so it's not so simple to just, if somebody gets a DUI in Greenfield, we might never find out about that, right? And so
Sure.
it's a lot harder to just make that quick handoff to, oh, this looks like a student, let's give them over to, student conduct. Our students, a lot of times being a little bit older age, non-traditional students, you can't tell just by looking at them, oh, this must be a college student downtown. So that makes the sort of off campus, especially if it's a ways away from campus, we're talking like a 30-minute, 40-minute drive away, makes it a lot harder to try to follow up and close the loop on some of those situations.
Absolutely. Certainly has some unique, not necessarily challenges, but things you just have to think through and navigate. Makes a lot of sense. You mentioned a lot of the developmental approach and some of the steps that occur when some young people maybe have as you said, a lapse in judgment. What are some additional programs that IU Indianapolis has for those that are specifically struggling with alcohol use? And how can some of those students access those resources?
Yeah, I mean, it's really, there's a lot of different pieces to it. It really takes a village. And so, I mean, it's everything from alternative programming, like our student activities programming board does late night events and weekend activities, things like that, just to give people something to do other than drinking on a weekend. But we like to have all different pieces of the continuum, right? We're going to have early identification tools like online screenings, like self checks that people can do, or even just health and wellness coaching sessions. If someone says, hey, I don't know if I am quote unquote bad enough, but like I want to cut back on my marijuana use, that's something that they can address in one-on-one coaching. And so we're always like listening to see, okay, does this person need a higher level of care, a medical intervention, or is this something we can address through behavior change? So there's a lot of different ways that it could look. So, I mean, really kind of the first step is just helping the student identify, or us trying to identify, who is this person that could benefit from, a tweak in what they're doing or in making a different change. One of my favorite programs, a great opportunity that we have for students to kind of have that aha moment, is our Sober October challenge, right? Because it's framed as sort of just like this fun challenge. It's really catching on more as like a pop culture thing. It's very common for people to do a dry January or a Sober October now, but that's such a crucial wake up call for someone if they go that first weekend and they can't make it a full week without drinking, to have that realization of, oh my gosh, like I thought this was going to be a piece of cake, and this is actually really challenging, whether that's, just their own routines, habits, their social network, their environment, whatever the additional challenges might be. That's one of the early ways that people might sort of get on the radar or have that thought enter their mind of like, yeah, maybe I want to go down a different path. Maybe I want to do something different in terms of my relationship with alcohol.
Yeah, that's it's interesting that the sober October absolutely getting, and I could see it how it could be a leading indicator, just a self-reflection of the student, let alone other supports on campus. You mentioned clearly it takes a village, and you mentioned IMPD and some others. So talk a little bit about how you work with other campus-wide or local organizations, community partnerships to help kind of promote safe and responsible drinking, particularly during this month, but again, all year long.
Yeah, so we do use a coalition approach on our campus, and so I'm one of the co-chairs of the coalition that we have organized along with one of the chairs from Healthy IU, which is like the employee health and wellness program. So with us combined, along with in a typical meeting that we have, which is about 6 times a year, we sort of convene the whole coalition to come together. We've got maybe 25 to 35 individuals from all different academic programs, schools, School of Medicine, law school, nursing, all these different professional degree programs. Everybody comes together because everybody sees a small piece of the puzzle. And so it's only as a group that we all get together, we can see, really the full picture. Our Office of Student Involvement might be seeing trends or in attendance or things that they see in evenings and weekends. And that might be very different from what our campus health folks are seeing as people that walk into the clinic or that are seeking, primary care services on campus. So that coalition, even just as a group for information sharing a few times a year, has been so valuable. But actually, some new initiatives have kind of grown out of that. We've been able to expand coaching. We've been able to organize information on our website in different ways. We've been able to tap into inside the classroom experiences that complement what we're doing in student affairs. So it's been just a great sort of like testing ground, a great like incubator. Sorry for all the buzzwords, but it's a great incubator for this kind of new initiative to kind of pop up. Whereas, you might not see the full picture if you're just behind your desk working away, at your job. So.
Yeah, and the coalition and that approach and those regular touch points and as you mentioned, helping some folks fill in the rest of the puzzle, right? Again, beyond what they might see. I'm sure you alluded to, and maybe didn't call out specifically, what we would call some best practices on campus. But what would you say is a best practice or two that's been most effective in helping reduce high-risk drinking and other behaviors on campus?
Yeah, gosh, I'm just thinking something that's just really on the front of my mind recently is how to take something from just a marketing approach and to give it kind of some teeth, give it some prompt somebody to sort of self-reflect and to make a behavior change. One of my favorite initiatives that we did, this was maybe a couple of years ago, we were really kind of in the thick of it. Our campus, we're typically a little bit higher than the national rate for students who self-report driving after drinking any amount of alcohol, which we attribute to, our campus population. There's no just one student neighborhood. It's really, the people could be all spread out. And so the temptation, if you're going to a buddy's house or going from one place to the other, the temptation to drive is probably higher than someone who can just walk from neighborhood to neighborhood in a smaller kind of college town. So combining not just posters on a wall, not just a flyer, but really this idea of activation events where students can see other students coming out and speaking about the topic. We would have these big pop-up displays, sign the drunk driving prevention pledge, but we know that just signing the pledge in and of itself is not going to be the thing that makes a change. We involve our peer health educators, we involve our social media, we involve email campaigns. So hitting things from a lot of different angles all at the same time, that makes it so it's really hard to miss, but makes it also so that it carries a lot more weight than just, oh, I saw this one tweet one time about this topic. It's about having that higher exposure, that longer commitment to it. It's really funny. We, in an office, we've got to get to the point where we are absolutely sick of hearing about this thing. That's the only way to know that you're actually spending enough time talking about an issue, is if you're just so gosh darn sick of oh, if we do one more drunk driving prevention, oh my gosh, this is going to be because right. Just to break through the background noise of the notifications people get on a regular basis and the emails and all the things that people are seeing, it takes that level of commitment to really kind of an initiative for several months to kind of break through. I think that's one example that sticks out to me, because it was really something where we were able to see in our campus-wide survey data over years, our self-report driving after drinking numbers start to kind of come down. And I mean, I'd love to take credit for that. It's probably also part of just national trends and people worrying about their safety or having more access to things like Uber and Lyft. But it definitely, it's nice to see it's moving in a good direction.
Well, and congrats on that. And you can take some of that credit, I am sure. And you never know about that frequency of contact, right? Because to you or to your staff, your team, you've seen it 10, 20, 100 times, but it's at one time at the right time for somebody to make a huge difference. So I understand, the need to kind of have it frequently out there and consistently. Eric, I appreciate this. There's a lot more we could dig into. You guys are doing so many great things on campus to help reduce this kind of risky behavior. But we're going to call it a close on this episode. Greatly appreciate it, Eric. Thanks so much for your time. And we will see you all again. Till next time, thank you.
Thanks a lot.